Welcome to this explainer. When we go to the doctor, we usually expect clear, straight answers, right? A diagnosis, a solid treatment plan, hopefully a cure. But what happens when medicine hits a massive gray area? What do you do when the right medical choice totally conflicts with what a patient actually wants? Or when the law says one thing, but your own conscience says something completely different? Well, today, we're diving into the hidden architecture of medical ethics to figure out exactly how life's toughest choices are made. To really wrap our heads around this, I want to imagine your doctor working on a super busy ward. You're caring for an elderly lady with dementia who is just incredibly distressed. For the third time today, she asks you why her husband isn't there. Now, earlier, you told her the truth, that her husband had passed away, and she became completely inconsolable. It was heartbreaking. So this time, you decide to just say he's delayed. Immediately, she's happy and willing to wait. So ask yourself, was that lie you just told actually wrong? This kind of heartbreaking scenario forces us to ask a really big question right out of the gate. Are we just dealing with personal morality here, or is this a much deeper, structured ethical question? See, personal morality is basically just what we were taught is right and wrong growing up. But in a clinical setting, that's just not going to cut it. We have to elevate this to an ethical question, because the stakes, a patient's actual well-being, are so incredibly high, we need a defensible, professional framework to solve it. So, here is our roadmap for today. We'll start with exactly what an ethical question is, then look at the three pillars. That's law, guidance, and ethics. After that, we'll hit the core ethical theories, the practical tools for reasoning, and finally wrap up with the actual decision-making process. Let's jump right in. Section 1. What exactly is an ethical question? Legal and medical scholars Mason and McCall hit the nail on the head here. They say ethics comes into play when we're faced with a true dilemma, meaning there isn't just one simple right or wrong answer. It happens when we're forced to choose between two or more paths that we can actually logically justify. Going back to our dementia example, you can absolutely justify telling the truth out of respect for the patient, but you can also justify the lie to prevent severe emotional harm. A truly wrong answer would just be taking a path you literally can't justify at all. When we bring all of this into a hospital or clinic, medical ethics is basically the structured moral philosophy that doctors lean on. It's how they navigate every single sensitive issue. And the absolute key here is that it treats the patient not just as some biological object that needs fixing, but as a human subject, someone with their own values, fears, and rights. It's the safety net professionals use when their own gut feelings or even just regular hospital customs aren't enough to solve a really sticky conflict. Moving on to part 2, the three pillars of law, guidance, and ethics. It's so crucial to separate these three ideas because, honestly, people confuse them all the time. The first pillar is the law, which basically asks, is this act lawful, and pulls from statutes and common law. The second pillar is professional guidance. This one asks, what's the required standard of practice here, and that comes from regulatory bodies. And then finally, we have ethics. This asks the deepest question of all, what fundamentally ought to be done? To make a truly sound clinical decision, you actually need all three working together. Let's zoom in on that first pillar for a second. Believe it or not, medical law is a relatively new, distinct field. Before the late 1980s, medical issues were mostly just lumped under general administrative or tort law. Today, it sets the absolute hard boundaries of what you can and can't legally do. But the coolest part? Evolving ethical standards can actually push the law to change over time, and vice versa. It's like this constant, ongoing conversation between the two. Meanwhile, professional guidance acts as the ultimate safety net. In the UK, for instance, this comes from the General Medical Council, or GMC. Under the Medical Act of 1983, their absolute top priority is protecting the public. They are there to ensure that every single ethical decision prioritizes patient safety and well-being, all while keeping up the public's confidence in the medical profession itself. Okay, part 3. Let's talk about core ethical theories. When a doctor is wrestling with that huge what ought to be done question, they rely heavily on what's known as the golden triad of moral philosophy. First up, virtue ethics. This looks at the character of the person acting, like what would a good doctor do in this spot? Next is consequentialism, which is all about the outcome, which action brings about the greatest good or the least harm. And third, deontology. This focuses entirely on rules and duties. Are you respecting the patient's fundamental rights, no matter what the outcome is? Looking at a dilemma through all three of these lenses gives you the whole shebang. So think back to our dementia patient. Virtue ethics wonders if you're acting with compassion. Consequentialism checks if the lie actually makes her happier. And deontology?
It asks if you're violating your absolute duty to tell the truth. Moving right along to Section 4, Tools for Ethical Reasoning. Now, let's be real. Dragging these massive, heavy academic theories into a chaotic emergency room isn't exactly practical, right? Doctors need highly functional, quick tools. And the most famous one actually boils all that complex philosophy down to one manageable number: 4. Developed by Beauchamp and Childress, these 4 principles are basically a quick reference compass for clinicians. First is autonomy, which means respecting a patient's right to make their own choices. Second is beneficence, meaning you must act in the patient's best interest. Third, non-maleficence. That's the classic age-old medical duty to simply do no harm. And finally, justice, which is all about the fair distribution of resources and equality. The trick here is that a doctor has to constantly weigh and balance these 4 principles against each other whenever they're in a tight spot. Another real game changer is the 4 quadrants approach. When a medical team is just totally overwhelmed by a messy, highly emotional situation, this tool helps them systematically sort through the noise. They literally divide the problem into 4 boxes. Medical indications, what are the clinical facts? Patient preferences, what does the patient actually want? Quality of life, what's the long-term outlook for the patient? And contextual features, are there family, legal, or financial issues at play? It's brilliant because it de-escalates the emotion and just brings pure logic straight to the table. Finally, Section 5, the decision-making process itself. You know, in medical ethics, how you arrive at a decision is often just as important as the conclusion you end up drawing. A proper ethical analysis needs concrete steps. Think of it like a pilot's checklist to make sure emotions don't accidentally override the facts. First, you have to clearly recognize the problem and gather the facts. Second, identify the relevant laws and professional guidance. Third, evaluate the risks and apply tools like those 4 principles we just talked about. And finally, conclude with a decision that you can solidly, confidently defend. But hey, the process absolutely doesn't end the second you make the decision. A massive, critical final step is to revisit and reflect on the outcome. And to be clear, this isn't about dwelling on the past or beating yourself up if things went wrong. It's about learning. It's about reminding yourself that you made the best possible choice, using the information, tools, and professional frameworks you had in that exact moment. Reflection is literally how healthcare workers adapt and sharpen their ethical reasoning for the very next patient who walks through the door. I want to leave you with this really powerful thought from Wilkinson and his colleagues. Making an ethical choice in medicine, it is not a gut feeling. It is definitely not guessing. It's a defensible, rigorous, scientific skill. Doctors have to appraise ethical values with the exact same intense scrutiny they'd apply to analyzing a blood test or performing a surgical technique. So, the next time you're faced with a seemingly impossible dilemma, whether that's in healthcare or just in your everyday life, how will you structure your thinking to find a path that you can truly, logically justify?